Hi, and welcome to today's webinar. My name is Kevin Hicks. I'm a field marketing specialist for Axonics and Bulkamid therapies, and will be moderating this webinar. This evening, Dr. Ephraim will be speaking about bladder dysfunction, the common symptoms patients experience, and treatment options that may help you gain control. Without further ado, I'd like to welcome Dr. Sonia Ephraim. Dr. Ephraim?
Good evening, and thank you to those of you who have logged on tonight. I'm excited because this is one of my favorite subjects to talk about, which is urinary incontinence. First, we have to take a pause for the cause. I have to display this important safety information. We have two slides here. This is safety information regarding one of the treatments that I will be discussing. And if you want to read this in more detail or get more information, you can find this information on the website at www.bulkamid.com. So as was stated, my name is Dr. Sonia Ephraim. I am a double board certified OBGYN and urogynecologist. And essentially what that means is I started my career as a general OBGYN. I did all the things with delivering babies and doing hysterectomies and things like that for the first 4.5 years of my career before deciding to go to fellowship so that I could subspecialize, because I found that my true passion was taking care of my patients who had essentially completed childbearing and were now suffering all the consequences of having those children, which causes problems with the pelvic floor. So now, as a fellowship trained urogynecologist, I take care of incontinence and prolapse and pelvic pain, sexual dysfunction. And because my population is older, I also take care of a lot of menopause patients as well. So tonight we're going to focus on incontinence and more specifically urinary incontinence. And so if you ever find that you leak urine or urine escapes your body when you cough or sneeze or laugh or exercise, or sometimes something even as simple as just walking, then you may be suffering from stress urinary incontinence. When the bladder functions normally, it is in a relaxed state and it fills to store urine. The urethra, which is the tube that we pee from, has a little muscular ring called a sphincter, and that sphincter is supposed to stay nice and tight and closed until we get to a socially appropriate time when we're in the restroom and we say, okay, it's time to empty. When we empty our bladder, the bladder muscle wall contracts and the urethra relaxes, allowing us to void. During physical activities such as coughing, sneezing, laughing, and exercising, there is pressure exerted on the bladder through our abdomen and our pelvis, and that pressure pushes down on the bladder. But under normal circumstances, that urethral sphincter is really strong and it stays closed, and we don't leak urine. Unfortunately, in women who suffer from stress urinary incontinence, that urethral sphincter muscle is weak. And so when the pressure is exerted, when we cough or have a good laugh with our girlfriends, or a sneeze catches us off guard, then the pressure is exerted, the sphincter muscle is weak, and urine is able to escape. The important thing to know is that you're not alone. There's over 30 million women suffering from stress urinary incontinence. So if you are in a crowded room and you look to your left and you look to your right and you see a woman beside you, one of the three of you is going to have stress urinary incontinence at some point in your life. Oftentimes, we're not talking about it and we don't know the prevalence of it because we're embarrassed or we're ashamed or we just don't even realize that there are options for treating it. So, why is it so important for us to talk about things like this tonight? Well, because 60% of women say that their symptoms impact their lifestyle and quality of life. It's not just an inconvenience of having to go to the store and buy pads, it is affecting our mental health. It worsens depression, it lowers our self esteem, it can cause severe anxiety. I have heard time and time again about women who don't want to leave their home, who always have to know where a bathroom is. When they go to the mall, they know where the best restrooms are. If they're on a road trip, they have to stop every time, and that can bring a lot of anxiety. It also affects our physical health. It affects our skin. The constant moisture, the wearing of pads can cause skin irritation and skin breakdown. Also, women who have stress urinary incontinence can have increased risk of urinary tract infections. And a lot of people don't realize that women who have stress urinary incontinence often find themselves committed to a nursing home. It is one of the leading reasons why women who, as they age, are committed to nursing homes. It can also affect our productivity. When we're at work and we have to interrupt meetings or take PTO because we've had accidents and leakage, that's a huge impact on our work and our productivity. It can also affect our family through changes in our sexual relationships. I've heard time and again women who don't want to be intimate with their partner, not because they don't care for them anymore, but because they're afraid of incontinence that may occur during intimacy. It can also affect our relationships with our children. I know many women who say they don't want to travel to their adult children's homes. They're embarrassed to stay the night because they don't want people to know that they have to wear pads. They don't want to have to throw things away in the garbage at their children's homes, and they're afraid of soiling a bed. Also, there's an economic burden. Women with incontinence are spending approximately $900 a year on absorbent products and laundry services. The good news that we're trying to spread tonight is that there are treatments that help. When you start your journey to find a treatment solution, it's going to be different for every woman. There are things like pelvic floor exercises, surgical slings, and urethral bulking that can be very helpful to improve the symptoms of stress urinary incontinence. And we'll go into each of those a little bit more detail. So, when it comes to stress urinary incontinence management, one of the first things that I discuss with my patients is behavior and lifestyle changes. There's lifestyle changes that you can perform and implement to help decrease the impact of incontinence on your life. One thing is maintaining a normal weight. And if you're overweight, decreasing your weight. Research has shown that even a 10% weight loss can improve symptoms of stress urinary incontinence. If you're a smoker, you want to quit smoking. Smoking does increase the risk of urinary incontinence. And if you have a chronic cough from any condition, even if it's seasonal allergies, you want to make sure that you're treating and preventing that cough. Then there's pelvic floor exercises. Pelvic floor muscle exercises such as Kegels can improve your symptoms by strengthening the pelvic floor. Sometimes we can do those exercises on our own, and sometimes we need the guidance of a pelvic floor physical therapist. It's important that you have your Kegels evaluated by your gynecologist or your primary care physician because I have often seen that women think they're doing the Kegel exercises, but in actuality, they're squeezing their thighs, they're squeezing their butt, and there's not a lot going on with the pelvic floor muscles. And in those circumstances, I advise okay, this is not something that you should be doing on your own. Let's send you to a pelvic floor physical therapist. They can give you the guidance and instruction, maybe use biofeedback to help to make sure that you're doing the exercises properly and that you're not wasting your time. Another option for the treatment of stress urinary incontinence is a pubovaginal sling, also known as a mesh. The material is a thin piece of plastic that's goal is to re-support the urethra. It is an outpatient procedure that takes about 20 minutes to perform, and it's about 80 to 90% successful in research studies that followed women for approximately 17 years. The procedure can be done under sedation, and you go home the same day. And it is considered to be the gold standard treatment for surgical management of stress urinary incontinence. Sometimes women who still plan to have additional pregnancies may want to wait until after their last pregnancy to have the pubovaginal sling performed because there's a small risk that if you have the procedure done, a subsequent pregnancy could decrease the efficacy of the sling that you had placed. But luckily, there's other options. Urethral bulking agents, such as Bulkamid, are injected into the wall of the urethra in order to bulk up the walls and prevent leaks. The procedure usually takes place in an outpatient setting, and in my practice, we can even do it right in the office under local. And you'll be able to go home on the same day. The procedure is very low risk and allows you to continue to be active immediately following the procedure. The whole procedure takes approximately 10 to 15 minutes, and it really is quite nice because the patients are so happy that they can drive themselves there, drive themselves home, and once the procedure is over, they're able to be active with no restrictions. So there's lots of patients in my practice who I've treated with Bulkamid, such as Kathy. These patients come in. The common story is that they're having incontinence. They've finally gotten to a point where it's limiting their life and affecting their quality of life, and they're ready to do something about it. And often I'm hearing that they have put off the treatment because they were afraid it was going to be a big surgery and they really weren't ready for that. Maybe they're very active, they have children they're taking care of, they have careers, and they can't afford to take time off for recovery. And when I have the discussion with them about Bulkamid, they're all extremely excited to know that there's an option that fits their lifestyle and can give them the results that they want. And afterwards, when I follow up with them, I hear nothing but positive things about how much their life has improved. So, what exactly is Bulkamid? Bulkamid's a minimally invasive, non mesh alternative to treat stress urinary incontinence. It's a soft, water based gel that is clinically proven to help improve or cure stress incontinence. I often describe it to my patients as a filler. You may have had fillers performed on yourself, or you know someone who has, specifically if they get it like into their lips to plump up the lips. Bulkamid is very similar to that.
Bulkamid can help provide the relief you've been longing for. The short, incision-free procedure typically takes less than 10 minutes. Involves 3 to 4 small injections of soft, water-based gel into the wall of the urethra to help prevent urine from leaking out of the bladder during day-to-day activities. It's safe, quick, and most patients can get back to your normal activities almost immediately.
So, Bulkamid is implanted to help form these cushions to restore a proper seal, which helps keep the urethra closed. So, we plump up in 4 areas of the urethra through a procedure using a cystoscope, a little teeny tiny camera that goes in, and I do the injection. It still allows you to urinate when you intend to, but it strengthens that area where that muscular sphincter is so that when you cough or sneeze or laugh, you're not leaking urine. And again, it's similar to a facial filler. It remains in the body without causing any adverse reactions to the surrounding tissue. So, what are the key things you need to know about Bulkamid? Number one, it's safe and it's effective. 92% of women reported being cured or improved following their treatment with Bulkamid. Number two, it's a very simple procedure. The procedure is a series of 3 to 4 small injections, as the video prior described, and it takes about 10 to 15 minutes in an outpatient setting under local anesthetic. And number three, it's long lasting relief. So you can have this procedure done, takes 10 to 15 minutes, and it can last 5 to 7 years that you won't have the symptoms of incontinence. And it can be done again. That's a very common question that I get is, okay, if it lasts 5 to 7 years, what do I do after that? Well, you come back in and we perform another 10 to 15-minute procedure so that you can have another 5 to 7 years of relief from your symptoms. Thank you so much for listening. Hopefully, I've given you a lot of information that you can take to empower yourselves to talk to your provider about your incontinence. If you don't have a provider to chat with and you want to come to my office, here's our contact information. That QR code will take you to my booking page, and you can feel free to schedule an appointment at your convenience.